you. So thank you, Joe, for that introduction, and thank you to Thrombosis UK as well for this opportunity to present this clinical trial today, this NIHR-funded study. And as Joe mentioned, the main aim around this talk is to just give you a bit more information about growth. And mainly we're looking for new sites to set up and to recruit patients. So if you are keen to get involved, then please do get in touch. Next slide, please. So just a bit of background on the study. As many of you are aware, patients admitted to hospital are at an increased risk of hospital-acquired thrombosis, which is defined as any VTE occurring within hospital admission and up to 90 days after hospital discharge. Hospital-acquired thrombosis represents a significant cause of preventable mortality. And prior to the nationally mandated programs of thromboprophylaxis, this was equated to around 32,000 deaths per year in England. Surgical patients are at high risk of VTE, particularly major orthopedic and general surgery. And as such, these patients require an extended duration of pharmacological thromboprophylaxis. And in addition to this, NICE guidelines recommend that graduated compression stockings should be considered in surgical patients to prevent VTE. And obviously there's a cost associated with the application of stockings. It's around £8.3 million per year in this group, but it also has a complication rate of around 5%. Next slide, please. So what is the actual evidence on the benefit of graduated compression stockings? So there's been a previous Cochrane review which reported a benefit for stockings, but this actually only included a few small trials with a small number of patients, and it excluded two larger trials from stroke and orthopedic patients, which actually didn't support the use of stockings. As Joe mentioned, Imperial previously ran the GAPS trial, which looked at the role of stockings in moderate and high-risk surgical patients and showed no additional benefit for the stockings when combined with low molecular weight heparin compared to just the low molecular weight heparin alone. But the GAPS trial excluded the highest risk patients, and those are the patients that we're looking to recruit for growth. And in 2023, the Imperial group did an updated systematic review as well, which showed no significant differences in the rate of PE and DVT between pharmacological prophylaxis alone and those with the addition of the graduated compression stockings. Next slide. So the aim of the GROW study is to evaluate the potential benefit of stockings in addition to the extended duration thromboprophylaxis, and this is for surgical patients at the highest risk of VTE. So you can see the inclusion and exclusion criteria here, and our primary outcome is imaging confirmed lower limb DVT with or without symptoms occurring up to 90 days post-surgery. So patients will have a research scan between 21 and 35 days, but they can also report any VTE outside of that. Next slide. So the study has a non-inferiority design which aims to demonstrate that the intervention arm is not appreciably worse than the control arm, and it's powered to detect a 2% non-inferiority margin, and for that we need to recruit 8,608 patients. And we are aiming to do that across about 40 to 50 NHS trusts and health boards across the UK. So yes, we really need more sites, so anyone interested, please do get in contact. Next slide, please. So here is just an example of some of the elective procedures of patients which are the highest risk of VTE and which will go home with the extended duration treatment. We, according to the protocol, we mandate that patients should receive at least 5 days worth of thromboprophylaxis post-discharge. Next slide, please. But by and large, the study tries to be as pragmatic as possible. So we don't dictate what sort of thromboprophylaxis that sites give to patients. And also the compression stockings, they can be worn as directed by the hospital as well. So some sites say patients should wear them until discharge, and others say they should wear them for much longer. But basically we'll just take this pragmatically, so whatever patients do with the stockings, as long as they're getting at least 5 days of the thromboprophylaxis. Next slide. So this is quite an easy study to set up and run. So the main recruitment going through the eligibility criteria and consented patients is done by the local site. Then patients have their surgery and follow their treatment arm, but the rest of the follow-up is performed centrally by the coordinating centre here at Imperial, apart from the scan, which is arranged locally. So participants are contacted at 7 days, between 21 and 35 days, and at 90 days. So participants can self-complete these questionnaires via email, or we will give them a call as well. So once the patients are recruited and have their surgery and have their allocation, then most of the burden of the follow-up comes to Imperial. We also report adverse events to do with the stockings or the thromboprophylaxis and adherence as well. And just to note that we pay £140 per scan for the research scan, as this is an extra one to standard care. Next slide, please. So it's a bit tricky to see here, but this is just the general flow of patients throughout the study. So patients are screened, consented and approached and randomised one-to-one between the two arms, and then followed up at the 3 time points post-surgery. And at 90 days, that's where their participation ends and they revert back to their normal standard care. Next slide, please. So it's an NIHR funded study, and there are appropriate per patient fees for every patient recruited and also for the scan. We've also got some funds, not much to be honest with you, but for the patients to travel to get their duplex scan and other associated monitoring and archiving fees as well. Next slide, please. So you can see our official timelines here. So we started on the 1st of January this year, and we have a 39-month recruitment period. And then there'll be the usual follow-up and analysis and dissemination. Next slide, please. So we currently have 16 sites who are actively recruiting. You can see those listed here. And we have some more sites in setup. But like I said, we need lots more sites to join. Usually it's the burden of the research scan that puts some centres off, or that they might find that they have difficulty with capacity. But we're not really mandating any specific recruitment figures at the moment. So if you feel your site could recruit some patients, then we'd definitely be interested in exploring that a bit further. Next slide, please. So this study is also under the Associated Principal Investigator Scheme, which is run by the NIHR, and may be of interest to trainees to get them on board to take part and maybe lead on the study. And it comes with some training and some form of accreditation. So it's great for any trainees who are interested in taking part in research. Next slide. So I think that's basically a summary of the study so far. And as Joe mentioned, I think there are email addresses in various places, but you can email the generic Grace Trial inbox, or myself or my colleague Francine Heatley, and we'd be delighted to answer any questions or tell you any more information about the study. Thank you very much.
Thank you, Rebecca. That was really informative. We have a few questions that have come in, and just having a look. Sorry, right. So somebody just wants to confirm: are patients on long-term antiplatelets included in the trial or part of the exclusion, such as aspirin?
Yeah, no, aspirin's not an exclusion. Antiplatelets are not an exclusion. So anyone on aspirin or anything like that, they are still eligible to take part. And we just exclude patients on who have a thrombophilia or thrombogenic disorders.
Brilliant, thank you. And a similar question, but around for DOACs at prophylaxis dose, such as rivaroxaban, apixaban, etc., for stroke prevention or other license indicators. Are those excluded, or would those be included?
If it's people who are on these at baseline,
yes,
already. Let me just check. So yeah, anyone is excluded who's on therapeutic anticoagulation. So that might be anything therapeutic for previous DVT or anything else. They are excluded from the study.
So on antiplatelets, definitely, but if they're already on a therapy because of a previous event, then they would be excluded. Yeah. Okay, that's lovely, thank you. Is the trial open to patients or hospitals from other countries other than the UK?
We're not yet, unfortunately, but we may. I mean, we'd definitely be keen to make contact if anyone is interested. Because if we do need to apply for an extension, then we might be looking to open other sites in other countries. So yeah, please do send details over if you are interested.
Brilliant. So really worth getting in contact.
Yeah.
But obviously, it's open to everybody within United Kingdom. So
yes.
Yeah, excellent. Yeah. And the bulk of the work really falls on Imperial. It's just trying to recruit those patients, and there is funding to support. Somebody's come in with a question saying, thank you, but given NICE says to consider a variety of thromboprophylaxis post-op, thinking aspirin for orthopedics, are they included? Are you mandating which type is used?
No, we're not. So yeah, we'll take anything as long as it's given for more than 5 days, so it can be considered an extended dose. We'll accept any kind of local pragmatic procedures that sites do, because obviously sites do things differently. So it's not stipulated in the protocol. No, just to try and make it as easy as possible, really.
Yeah, it's really working to local protocols and then get the guidelines around the trial.
Yeah.
Brilliant, thank you. And if newly recruited doctors or people are interested in getting involved in research, can they also, which you mentioned earlier, can they also email you to see how they might be able to get involved with this, or how they might be able to work locally to recruit and work with you?
Yeah, definitely, absolutely. Yeah, we're always interested to get people to help with recruitment, or to help with anyone who's interested in research. Yes, absolutely.
This closes ideally if numbers are reached in 2026. When do you expect to have the first data and reports coming back or being published?
Yeah, so there'll be once patients have completed their 90 days, so whenever the last patient has their 90-day follow-up, and then obviously there'll be a period of data cleaning, which 4 to 6 months, and then we hope to get the results then. So yes, it's quite a long time period, but it will be around that point that we will hope to see some initial results. There are some kind of interim analyses that will go on prior to that kind of act as a stop-go criteria that are stipulated by the funder. So that's why we're desperate to get more sites on board, because at those time points the funder could close us down because they don't think that we are able to recruit enough participants. So yeah, we're keen to get more patients as possible.
So really, if you're interested, or if you think people within your department or medical centre would be interested, please do signpost them to this trial. This is a game changer, some of these trials, aren't they? Because of how we protect patients, look for their best outcomes, but also looking to make it most cost effective as well, and what is offered. So it's
and hope it will add to the kind of data of the other studies. Like you said, the PET trial, the GAP trial's finished, the PET trial's still ongoing, and it will add to this kind of tranche of evidence, hopefully, that will question the use of graduated compression stockings, and might potentially be a large cost saving in the UK.
Listening to Professor Hunt earlier this week, it's so interesting to see that their use often so widely with so little evidence based. That if we can get these successful trials through, we'll be working from evidence, which will be best.
Yeah, and how difficult it is to kind of change practice once it's embedded, but especially in the hospital culture, because some of the the deviations we see within the trial are maybe someone that has put the stockings on, because it's quite so many specialties that are being recruited for this study, that one nurse might decide to put the stockings on when they're not supposed to be randomized to the study in the study arm. But yes, hopefully with some more robust evidence, we'll be able to provide something for the community that they'll be able to say, just our stockings an extra benefit in addition to the adequate thromboprophylaxis.
Give confidence to that policy and that implementation as well, that you are following best practice, because there's the evidence. Yeah. So
yeah, because I think a number of sites have looked at the GAPS data, but they still want to see a bit more data for a surgical population, and especially a high-risk surgical population.
Definitely, yeah. Thank you so much. I think we've exhausted the questions, but the email is available for anybody who comes up or wants to make contact and learn a little bit more, consider being involved. Please do share and consider joining, because this is important. And it'd be great finishing this on a real positive, how everybody can get involved. So thank you so much.